Hey there, it's Dr. Jim. Thanks for taking some time to watch this video. I appreciate it. My topic today is based on some writings in my book, Living Longer and Stronger with CBD. If you haven't picked it up yet, you might want to think about doing that. Between 500 to 600 studies, medical studies, I wrote about, and one of those conditions is MS, multiple sclerosis. So the topic of this video, and I have an article which goes into greater detail, so check that out too. CBD and multiple sclerosis. What do we know? Well, I could start by telling you that MS is one of the most devastating neurodegenerative disorders. It affects over 400,000 people in the United States and almost 2.5 million people around the world. Now, there's a lot of great research going on, but a cause is still unknown. Medications may help to manage symptoms and bring a little quality of life, but as we all know, most meds come with side effects. Some are mild, some are moderate, and some are pretty dangerous side effects. Experts in cannabinoid research have been really looking into the effectiveness of CBD for multiple sclerosis. And I'm here to tell you that they have very encouraging results. There's good news. So let me give you a snapshot of multiple sclerosis. It's chronic, and it's a progressive inflammatory disease. And it's a disease of the central nervous system. And essentially, there's a demyelinating of nerves that affects the way nerves work. And while symptoms of MS vary from person to person, and they come and they go, and there's a remission, and then they come back depending upon the type of MS, here are the most common symptoms that I have found throughout the medical literature. None of them are pleasant. Pain, muscle spasticity, inflammation, fatigue. Depression is very common. Weakness, numbness or tingling sensations. Stiffness, difficulty walking or maintaining balance, which is rough if you're still working. Dizziness or vertigo at times. Memory and other cognitive changes and issues. And actually changes in hearing and vision may occur. So you take a couple of those symptoms, 3 or 4, and what happens, it starts to impact a person's quality of life, living, work, career, independence. All of these things are extremely important. And as people start to experience those things, their mood changes, depression, anxiety set in, and it's not a good thing. So while the exact cause is still unknown, MS develops as a result of the immune system attacking itself. So specifically, the body attacks myelin, the fatty tissue surrounding and protecting nerve fibers. And as that occurs, there's a disturbance in communication between the brain and the rest of the body. Now, who is at risk? That's an important question to ask. MS is usually diagnosed earlier in life, between the ages of 20 to 40, somewhere in there. For some reason, the disorder is more common in women than in men, and the ratio is actually 3 to 4 women for every 1 man, so that's significant. And while the disease is not technically genetic or familial in nature, having immediate family members with MS does increase your risk of developing it yourself. Now, there are other risk factors for developing MS. Living in northern regions around the world, that's a fascinating one. Obesity, smoking, certain autoimmune disorders like type 1 diabetes and rheumatoid arthritis, and certain infections like the Epstein-Barr virus and human herpes virus 6. So let's look at how MS is treated, and then let's compare that to the effectiveness of CBD. So we'll go traditional medicine, CBD. All right. Traditionally, treatment for multiple sclerosis focuses on speeding up recovery time from attacks, slowing down the progress of the disease, managing symptoms, and of course, improving quality of life. So, current methods of treating attacks include corticosteroids to reduce nerve inflammation and plasma exchange when there's a poor response to steroids. Some treatments used to slow down the progression of the disease include use of beta interferons, which reduce the frequency and severity of attacks, and glatiramer, which is used to stop the body's attack on myelin. Other medications are used, but like I said, they come with pretty bad side effects like infections, headaches, high blood pressure, liver damage, hair loss, heart problems, and blurred vision. So the individual already has these symptoms of MS, and now they're having side effects of medications that they're taking for MS. Psychiatric medications are also used many times to try to manage depression, anxiety, this lack of energy, or fatigue. So here are some non-medication based treatments. Physical therapy can be very effective, rest and relaxation, because the body does have this natural ability to heal itself to a degree. Mindfulness, living in the moment instead of worrying about the future, which is difficult, right? Stress management, exercise and nutrition, yoga, light types of exercise, massage therapy, prayer and meditation. And of course, emotional support, social support are very important. So while medications and lifestyle modifications can help to manage symptoms, it's important for that person to be connected to family, friends, healthcare providers, spiritual leaders. All of these people can be very, very helpful. Now, let's look at CBD and MS, what we currently know from research. Okay, in 2007, researchers from the UK tested the efficacy, safety, and tolerability of an oral spray, you spray in your mouth, containing THC and CBD, so it was a combination, and found that it was effective in treating painful spasticity. Another team found that it was also effective in treating neuropathic pain, which comes along with MS. A research team from Madrid, Spain, found that CBD had long-lasting protection against inflammation. It provided immunoregulatory effects. It improved motor or movement deficits and had neuroinflammatory benefits. Those are all really good results. I'm encouraged by those results. In the United States, investigators found that CBD was useful in treating spasticity, pain, inflammation, fatigue, and depression, and, maybe most importantly, with no side effects. No serious interactions were seen when combining CBD with medications to treat MS. No problem. Another study revealed that an oromucosal spray containing both THC and CBD was effective in treating MS-related spasticity, stiffness, pain, spasms, and it improved overall comfort. So here are my final thoughts. MS is a chronic, debilitating, progressive, neurodegenerative disease that only gets worse over time, and it really impacts a person's quality of life. People experience very painful, negative symptoms. They may be taking medications that are causing unpleasant to downright dangerous side effects. If CBD can be a treatment by itself or in combination with THC, then I believe that that's a really good thing. I'm a big fan of this. I'm a big fan of all natural, organically grown, comes from the earth. So I believe that there is a lot of hope in this research. So if you're interested, go to Google Scholar, type in CBD and multiple sclerosis, and see what you come up with. Thanks for your time. I'm Dr. Jim. Keep coming back for more education and David Bowie. Catch you later. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.